This patient was referred to me 5 months ago. 5 months ago for examination evaluation of tooth number 31. Patient's chief complaint was pain. Patient had pain. Pain and also pain to chewing, biting down on the tooth sometimes. According to the patient, this root canal was done by her previous dentist about 4 to 5 years ago. So patient also admitted that she had dental anxiety. The only thing that she allowed me to do with the tooth was, of course, taking radiographs like this. And when I had the patient bite down on a Q-tip, she jumped out of the chair. Now take a look here. You can see a large amalgam build up here. I noticed a couple of small cracks, one in the mesial wall and one in the lingual wall, but patient didn't let me probe because of her dental anxiety. But you can see that probings would probably be around maybe 2 or 3 millimeters. I don't see any bone loss. If this was a split tooth, you definitely would see some bone loss on the coronal bone loss around the tooth here. Look at multiple angulation PAs here. You can see, of course, a large amalgam buildup, prefab metal post. You really don't see any periapical relucencies, all right? If this patient didn't have any symptoms, any issues with this tooth, I would tell the patient to leave it alone. But this patient was going to have the tooth restored permanently, was going to get a crown or a bridge or what have you. As you can see, tooth number 30 is missing. So the tooth was going to be part of a bridge. So, and you can see, as I said, if this patient did not have any issues, any symptoms, and the tooth was going to be left alone like this, I would have told the patient to leave it alone. No need to redo the root canal. But because this patient had plans for this tooth, the dentist had plans, and the dentist was going to use this tooth as an abutment for a 3-unit bridge, of course, we needed to redo the root canal. Why? Because the dentist who did the root canal missed the root. Missed the root on the mesial. There is another root on the mesial that this dentist missed. It's right here. So, of course, we needed to redo the root canal. But as I said, if she wasn't going to use the tooth as an abutment for a 3-unit bridge, I would have told her to leave it alone. But now we definitely needed to redo the root canal. And that's what we did. Patient was very anxious, was very difficult to work on her, but we did it. We did it anyways. But, you know, don't want to blame the patient, but with patients' dental anxiety, you just want to get it done. They're anxious, they're nervous, you don't know if they're going to jump. She refused to be sedated. So we went out and did the root canal and found, of course, the other canal, the other root. As you can see, the other root was completely separate. So I did selective. There was nothing wrong, no periapical relucency associated with the distal canal, as you can see here. We have multiple angulations of that. You can see no issues with the distal root, no periapical relucencies or anything like that. But take a look. The canal that I found, I obturated it long. My fault. Obturated it long. As you can see. So I told the patient, I said, please come back to see me. Just have your dentist replace my temporary filling with a permanent filling. Don't get a bridge yet. I want to make sure this tooth is okay. Come back and see me in a few months for a post-op so I can make sure that everything's okay. And patient agreed. Well, patient came back to see me today after 5 months for a 5-month post-op, I guess. And my temporary filling cavit was still there. I asked the patient, I said, why didn't you replace my temporary filling with a permanent filling? Let me show you the 5 months post-op. So this was immediately after I had redone the root canal for this patient. And here's the date, as you can see. 3/25/2024. Today is 9/26/2024. So I'm sorry, 6 months. So 6 months ago. So she came back for her 6 months post-op. And so this was, as I said, immediately after I had redone the root canal 6 months ago, as you can see. Today is 9/26/2024. All right, take a look here. Here is the 6 months post-op, and here's the date, as you can see, 9/26/2024. 6 months post-op of the tooth. What happened to all of that gutta percha? Gone. No periapical relucencies whatsoever. No symptoms. You can see the little decay starting to develop here. Patient still has my cavit from 6 months ago. Still has the cavit from 6 months ago. Cavit is only good for 3 weeks. Cavit is a temporary filling. Multiple studies have shown cavit is only good for 3 weeks. So saliva bacteria could potentially go through the cavit and contaminate the root canal here. So I told the patient said, oh, I thought I went to my dentist. I thought my dentist worked on the tooth, but I guess he didn't. I said, he didn't. You still have the cavit from 6 months ago when I redid the root canal for you. Anyways, you know, this stuff like upsets me a little bit because they're out of my control. I have no control over this, but then it affects my work. But as you can see, no periapical relucencies. What happened to that? What happened to that extruded gutta percha? It's gone. It's gone. This is just sealer now. Sealer here, sealer. That extruded gutta percha is gone. So remember Dr. Lin's study, the extent of obturation doesn't affect the outcome of endodontics. This is another example. So I knew the science. It was unintentional. Of course, she was anxious and nervous, and you know, it was unintentional. It was my fault. Again, I should have double checked, but it happens sometimes, you know, sometimes that happens. But I was pretty confident that it wouldn't cause any issues because I know my science. I know my science, and also I follow every single step in the fundamentals of endodontics. So when I do that, when I adhere to the fundamentals of endodontics, usually the endo gods, they're forgiving. And as you can see here, that was the case. So that piece of gutta percha is gone, basically. There's nothing there, it's not there. And no periapical relucencies or issues, as you can see here. But as I said, my cavit is there still from 6 months ago. So I told the patient that we told you verbally, orally, and gave you a post-op instructions. And post-op instructions, we also tell you, please see your dentist within 3 weeks, no more than 3 weeks after the procedure. And again, she's a little bit older, and she said, I thought I went to my dentist and I thought my dentist worked on it. Okay, of course, I can see the cavit. Anyways, 6 months post-op of tooth number 31. As you can see, no issues, no problems, no periapical relucencies. That gutta percha, overextended gutta percha, is gone. So there you go.